When your gum tissue is receding, the roots of your teeth will become exposed. Roots are softer than crowns since they're not covered with enamel, which is extremely strong, but with cementum, which is much softer. Therefore, roots are at higher risk to develop decay or to be worn away when brushing your teeth. When decay develops in that area, it often is challenging to repair since it is so close to the gum line and since dental filling materials adhere poorly to root surfaces, leading to those fillings popping out frequently or developing further decay underneath. It is often difficult to clean exposed roots since the toothbrush tends to skip over them. This leads to accumulation of bacteria, which can cause root decay and gum inflammation. The gum inflammation can then lead to further gum recession and to a worsening of the problem. Wearing away of the roots when brushing your teeth, also called cervical abrasion, can lead to root notches, also called non-carious cervical lesions. These notches tend to get deeper over time and can weaken the tooth or in extreme cases reach into the root canal. Cold sensitivity is a frequent consequence of gum recession since tiny little nerve fibers on the root surface become exposed. Sometimes gum recession can lead to aesthetic consequences, making teeth look longer. To treat gum recession and to prevent any of these potential complications, a gum graft may be needed to regenerate the defective tissue and cover the exposed roots. Teeth, especially when they have crowns or other dental restorations acting as potential irritants to the gum tissue, require a band of stable, dense, and keratinized tissue around them. If the gum tissue is thin, if it is not attached to the underlying jawbone, or if it is loose, the affected teeth are at a higher risk to develop gum recession, periodontal bone loss, root exposure, and in some circumstances, a higher risk for infection. A gum graft can regenerate that stable and protective layer of gum tissue and hence can minimize the risk for further gum recession, periodontal bone loss, root decay, and periodontal infections. It also has been demonstrated that dental implants with thin and loose gum tissue around them will develop peri-implant bone loss and infections more often than dental implants with stable and keratinized gum tissue. Therefore, gum grafts are sometimes needed to increase gum tissue thickness and stability around natural teeth, and to improve the long-term prognosis and health of dental implants. During a gum grafting procedure, a piece of gum tissue is taken from the roof of the mouth, also called the palate, and is transplanted to the area where gum tissue is deficient. The palate is called the donor site since it is donating the tissue. The area receiving the graft is called the recipient site. In most cases, the gum graft can be harvested underneath the skin on the roof of the mouth using microsurgical instruments. The donor site is then sutured, leaving only a small incision. Such grafts are called subepithelial connective tissue grafts since a layer of connective tissue underneath the skin is used as the transplant. In some cases, the skin of the gum tissue also needs to be transplanted. These grafts are called gingival grafts since the whole gingiva, including both skin and underlying connective tissue, are transplanted. This will leave a larger area to heal at the donor site. The gum graft is then transplanted to the recipient site. Microsurgical incisions and minimally invasive surgical techniques are used to prepare the recipient site in a way that the graft can heal and integrate. During the healing period, the graft will fuse with the surrounding gum tissue and attach to the exposed roots. This will lead to a regeneration of the deficient gum tissue. The procedure itself will not hurt since you will be numb and will usually take about 1 to 2 hours per treated area. In some situations, it is not necessary to take tissue from the roof of the mouth. Then a dermal allograft or a collagen matrix may be used instead. A dermal allograft is human skin donor tissue, which has been processed so it is safe to use. A collagen matrix is made from porcine collagen, collagen from the pig. Both materials are safe to use and have been tested extensively over many years. When compared to autogenous grafts, non-autogenous grafts tend to resorb more over time and do not provide for the same long-term stability of the grafted area. Therefore, they should only be used in certain clinical situations. Soft tissue regeneration procedures are routine and highly predictable when performed by an experienced and well-trained clinician. Possible complications include excessive bleeding, infection, nerve injury, and graft failure. With proper planning and execution, and when postoperative instructions are followed, these complications are rare. Should a graft fail to integrate, which may occur after an infection, the procedure may have to be repeated. Numbness at the donor site is common and usually resolves within a few weeks or months. Permanent numbness in small areas of the donor site or the recipient site is possible, but extremely rare. Bruising and swelling are common and usually last for a week. You will have to eat soft food for 6 weeks after the procedure and will be asked to minimize physical exercise for the first 2 weeks. Postoperative antibiotics will be given to prevent an infection. The procedure itself will not hurt since you will be numb. There will be mild to moderate discomfort for a few days after the procedure, which usually can be managed with over-the-counter pain medication. The reputation that gum grafts are painful is based on outdated techniques, which left the donor site open and unprotected after the procedure. With the palate being a high-traffic area, which is constantly irritated when eating, drinking, speaking, or even swallowing, an unprotected donor site used to be painful and took several weeks to heal. This is not the case anymore with current minimally invasive surgical techniques and the use of a palatal bandage. A palatal bandage is a transparent appliance and looks like a clear aligner or Invisalign retainer. It snaps on your upper teeth and covers the roof of the mouth during the healing period. I will ask you to wear that appliance 24/7 for the first 2 weeks after the procedure. It should only be removed twice a day when brushing your teeth. The palatal bandage protects the donor site, eliminates almost all postoperative discomfort in that area, reduces bleeding, and substantially cuts down healing time. So, congratulations for visiting our office today and for taking the first step to healthier teeth. We're looking forward to treating you.